if you think about the knee, we've got the bony parts of the knee, and then you have what's called ligaments, and ligaments are to stop movement. And then you have muscles, which are to create movement. So you have ligaments on either side, one from here, from the tibia to the femur, one on the other side. And that's to stop your sideways motion. You get a force that pushes the bone across, and the ligament on this side will stop it doing that, and vice versa. Now you've got two other ligaments in the knee. There's the one from the front coming back and one from the back going front, and those are called your cruciate ligaments, and that is to stop your sideways motion of the knee. Now you have muscles, and that's why we've got these painted bits on the bones. The blue bits are where the muscles insert, and the red bits are where they start. And so you have muscles, and when a muscle contracts, the hamstring at the back contracts, it's going to bring this leg into this motion. Yeah, and then when you want it to go the other way, the muscles on the front shorten and contract and bring it back that way as well. Cartilage sits on the surface of the bone, and that's because bones do not like rubbing up against each other, and you certainly don't like bones when they rub up against each other because they cause pain, and that's what happens in arthritis. Now there are two meniscuses, and they're C-shaped, and they sit on either side of the knee here. And what happens there is that they help the knee glide back and forth in this motion. In addition to that, you have what's called bursas, and bursas are little almost like gel packs. They're not obviously made of gel, and what they do is they help things slide across each other, one across the other, and that enables the surfaces not to rub, and enables muscles to not to fray. So if you had an example of a cliff, and the rope goes over the cliff, and you've got a climber on the bottom, yeah, that rope, as it goes over that surface, is going to rub, and eventually, it's going to fray. In the knee, you might have an area where a muscle comes over a bone, and you're going to put a little bursa in there, a little gel pack, so that as that muscle comes over, it rubs up against this nice soft thing and doesn't cause a problem. So if you've got bursitis of an area, itis just means inflammation. So inflammation of the bursa, if you've got bursitis, then basically it means that the knee is not sitting the way it should be sitting, or is not operating the way it should be operating, and therefore you're getting inflammation of that bursa because the muscles are not doing what they should be doing.